Today we had some great interactions, some very interesting presentations, everything from chicken nuggets right the way through to the NHS and how they're using digital technology. So some really interesting talks, and again some quite thought-provoking ones as well when we were looking at the issues with opioids and homelessness as well, which is a critical issue, and one that I'm sure we can focus on as well from a kind of digital perspective. So with that, then, this is also Digital Health Week. We're in the day 3 of Digital Health Week, and that's the 6th anniversary of that event, which allows us all to kind of focus on the role of digital in improving healthcare and where we can bring the entire community together. And talking about that and celebrating, Digital Health Canada celebrates every year by announcing the recipients of their Women Leaders in Digital Health Award. The winners this year, who are posted up on the screen there, are being honoured for their impact in Canada and on health in Canada, and for their contribution to the advancement of digital health through leadership and influence in 2019. So please join me in congratulating this year's recipients. Put our hands together. Well done, everybody. Okay, so that then leads me into my first slide, and I've got the clicker here. And so today and during this morning, I want to cover 3 areas, basically. The progress that we've made. Last year, we launched the Access program, a new branding, so I want to cover the progress we've made. Also, the challenges that we continue to focus upon. And then a future. What is going to be the future where digital health can figure prominently as a catalyst for transforming healthcare and improving the patient experience? And so before I begin doing that, how many people were here at last year's partnership? So there's quite a number, probably about 25%. Last year we were in Montreal. We also had a very good turnout. And so moving on from there, just get my, here we are. Okay, so of course, last year we launched our new brand, and we've got the new colours that we have now, and I think it's a much more crisper kind of brand that we have with the Canadian maple leaf there. And but the key thing is that our goal of kind of improving health for Canadians through innovative digital health solutions has remained the same. So we continue to focus together with our partners in the private, public sector on how we can accelerate the adoption of digital health technology. And I want to talk a bit about the programs that we have, and in particular, having a bit of issue here, in particular, Prescribe It and Access Health. So most of my talk this morning will be focused on the Access program, but of course I want to talk about Prescribe It as well. We launched Prescribe It in 2017, and we've continued to make a lot of progress on that file. And I'm really pleased to kind of say that today we're now live in 4 provinces, in Ontario, Alberta, New Brunswick, and Saskatchewan. We've got MOUs in place with all the other jurisdictions but 2, and we're hoping we can bring them on board as well. And the system is now scaling up. The other day we hit 1 million prescriptions went through the system in total. We now have 263 communities lined up. On the clinical side, there are 1,800 prescribers. 2,000 pharmacy sites are currently enrolled in Prescribe It. So I'm really proud of what the team has managed to accomplish with the help and heavy lifting of many of you in the room. So it's a great example of the private sector, public sector working together, both in retail, in health IT, and in care delivery. And this is a really excellent kind of example of important work that can improve medication access and also the safety of medications across the system. And together with this, I'd like to acknowledge Bobby Reinholt. Bobby is the Executive VP who spearheaded this initiative from the beginning, and it's a significant reason why Prescribe It is the success that it is. Bobby's been working extremely hard with her team over the last few years, and now she's decided to take a well-earned retirement. And so this conference marks the last few days of her employment with Infoway, and I'd like, if Bobby's in the room, if Bobby could stand up, and we'll give her some applause, but she may not be, maybe she's retired a couple of days earlier. But anyway, let's give Bobby some applause. Okay, so then the second major strategic initiative that we launched more recently is the Access Programme. And the goal of Access is simple. It's to provide Canadians with access to their health information and to provide them and their clinicians with the digital tools and services they need to better manage their health. And we're leveraging many of the principles and lessons learned from Prescribe It to accelerate the Access Programme. And I'll spend more time talking about this initiative throughout the presentation. And first of all, I want to talk about the progress. So there's still an awful lot of work to be done, but in the spirit of Digital Health Week and the theme of celebration, let's take a few minutes to reflect on how far we've come over the last few years. So first of all, now 70% of Canadians are able to access some of their health information electronically. And this number has tripled since 2015, which was only around 20%. So I think that in its own is a great achievement, and that's a strong enabler for getting these systems up and running in place. And then in addition to that, one of my favorite slides, Infoway's had about $2.5 billion worth of funding from the federal government. The provinces have put in similar funding. But overall, we measure the benefits, and we can see that this has resulted in a $30 billion benefit to the system in terms of time saved, reduced unnecessary exams, and so on. And I think we beat Wall Street and the TSX and everyone on this particular figure, and it's only going to grow further as these incremental gains come in place. And then when we look at clinicians, and I particularly liked the comment that Simon Eccles made yesterday, that in the NHS, they want to look at digital technology that is going to make life easier for clinicians to deliver care, and not something that's going to stand in the way and cause additional work and headaches. And I think that's something that's very difficult to achieve, but if we don't achieve that, then certainly we won't see the digital benefits passed on to patients and the population. And so now we can see about 66%, two-thirds of healthcare professionals are using connected health information. They're routinely accessing lab, drug, diagnostic imaging, and other information electronically, and about nearly 250,000 of these users have access to clinical information that's integrated into their EMRs and other point-of-care systems. So we've certainly made a lot of progress in these kind of areas. And so what are we doing with the Access Gateway? So as a reminder, the Access Gateway is our technology platform and the foundation of the Access program. After doing an RFP process in the spring, we awarded one of our first contracts, which was for identity access and consent as a service to Simeo Solutions, and the build of the Access platform is now underway. This is a key milestone for us to identify as identity services is the first kind of foundational component of the gateway. A second procurement is underway for software development and testing, and also a third one for cloud services are currently undergoing evaluation as well, and we'll shortly announce the results of those processes. So truly, a new day in healthcare is coming. We've also launched our social media movement, the Access 2022 movement, that was launched at Partnership last year. And as a reminder, with that particular program, it's a social movement campaign that's aimed to build awareness about the possibilities and inspire action around the vision of a new day in healthcare in Canada. One where patients, families, and clinicians have access to their personal health information seamlessly, and also to digital tools and services. And I hope that all of you have had a chance to visit Access 2022.ca website, have looked at our hero videos, which feature patients, entrepreneurs, and clinicians who are digital innovators making a difference. You'll probably recognize a few of these heroes as we show the video in a second, and some of them are amongst us in the audience. And so I want to now show a short video.
My name is Elisa Simon. I'm the Vice President of Service Innovation and the Chief Youth Officer at Kids Help Phone, and I'm part of Access 2022.
Hi, my name is Aiden, and I am part of Access 2022.
Je suis Dr. Julien Quinty.
My name is Dr. Kumanen Wilson.
I'm Zaina Kayat.
I'm Mark Sommerfeld.
I'm Ian Lording.
My name's Terry Price.
I'm Colin Hung.
I'm Kim Ganny, and I'm part of Access 2022.
So all of those videos really kind of feature great examples of how digital health is making a difference in a number of different areas, right the way through from mental health with Kids Help Phone through to personal health records and so on. So take a look. I think they are really good. So the other really important thing, and of course we are here in partnership, is that we launched last year our Access Alliance movement. And we announced it last year, and we had an open call this year for companies to join us to make an investment and be with us on the journey of foundational partners to help us work with other partners to kind of form the strategy of the Access program. And I'm very pleased to say today that we have 7 sponsors signed up. We've got Accenture, Life Labs, Orion Health, Roche Canada, RGAX, Teladoc Health, and TELUS Health, who have all joined us on this program. And we probably have a couple of openings left if anyone else would also like to come on board and certainly speak to me or Barry Burke, who's in the audience, and we can sign you up. But leading on from there, one of our key goals is empowering patients. And digital technology really has the ability to put people at the center of their care. And putting people at the center, giving them access to the information, the digital tools and services they need, will really make them full partners in their healthcare. And so I've got an example that we're using of a fictional patient, Jane. And, she's a kind of 55 years old, as you can see. She lives in rural Manitoba, got a family history of type 2 diabetes. She recently had some surgery. And then she's having, some problems, a burning sensation in her left foot and so on that's been bothering her for a few days. And so, of course, she needs to, go and consult her physician. And, I think as we map out the journey as it is today in a paper kind of driven system, it's a consecutive journey. And it makes me think a little bit about the journey I have every day on the subway to get from Chester to St. Andrew. And if you know the Toronto subway system, it can be fantastic. But when it breaks down, all hell lets loose. And the problem is that any one point along this journey that does break down, it's going to hold the whole thing up. And I think that's one of the messages really about the kind of analog journey of health, is that first of all, symptoms kind of manifest themselves. You're going to have to go and see your doctor. If you live in a remote community, you may have to wait. You've got to take time off work to make the appointment. You get there, you're going to be seen perhaps for 15 minutes or even less. And then you're sent away. You've got to have a blood test done. You've got to then come back to get the results. You'll probably be referred to a specialist, which will be a kind of paper-based thing. You won't know when the appointment's going to be. When it does turn up, it could be a few weeks later or months in some cases. And at that time, it may not be a time that suits you anyway. So that, as we all know, and we've been through these journeys, there are a lot of issues which could be tackled with in a more effective way and perhaps have been dealt with in other areas that we do our business and where digital has kind of increased and improved the patient or the consumer experience. And so now, in the digital journey, let's kind of fast forward to that. So now what we see is the patient, Jane, is at the center of her care. She could be wearing some technology that, combined with a smartphone, can access personal health information, help her manage her diabetes. Technology can also alert Jane to any issues and help her navigate the system. Appointments can be booked online. You can look at your diagnostics. You can connect to access treatment and resources. And resources can be reviewed as often as you like. If there's any kind of education that's done, this can be reinforced. And so there's so many things that can be brought to the benefit of the patient through digital channels. And again, if you're monitoring in this way, if you have some complications, those could be flagged up in advance. Your clinic could automatically be flagged up, and then you'll get a call to go and see the doctor when you need it. And so the journey is going to be a much more confident one, confident about the care, more knowledge, people are more knowledge about their conditions, and we'll have more meaningful discussions with the GPs. And I think this is what digital-enabled care can look like. And we all know that it's not just saving patients time, but if we can eliminate a number of these unnecessary visits, it frees up the resources for more important work to be done. Patients who are critically ill can get to see a doctor at the right time and have the right kind of tests that are available. So there's so many tremendous benefits of this digital revolution. You have to wonder, why aren't we doing it all now? And so sadly, we're not there. And there are some major challenges that need to be addressed. And a number of these challenges are ones that we are trying to look at within the Access program. First one is in the area of trust. A fundamental component of health system is the exchange of information, and it's essential that trust is a fundamental part of that. So today, we've got different legislation across the country that really complicates establishment of these trust relationships, and we need to safeguard patients' confidentiality, but we also need to find a way to exchange the data between parties, between authorized parties and private sector as well, I think, because the innovations come from the private sector, but we need to do it in a thoughtful way. And so we can't have that as a barrier. Sometimes a government organization can take 6 months to negotiate a data exchange agreement with a hospital. I mean, that's crazy. We need to kind of overcome these things. Then interoperability. This is, we kind of represent Canada on a forum called the Global Digital Health Partnership. And that's a group of 25 countries, and they're all tackling the 5 biggest issues related to digital health, the 5 biggest challenges. And interoperability is perhaps the biggest of the 5. And I can assure you that our frustrations with interoperability are shared by our colleagues around the globe. We have well-established standards for the most part, but many of these standards have been implemented differently. And standards, of course, are very necessary, but they're not the only answer to the issue. We also need to have IT-enabled specifications that go along with the standards to ensure that we can exchange data in a seamless way between practitioners. Then access. So similarly, improving access to health information is the top issue for Canadians, but Canada doesn't perform as well as some other countries in providing citizens with access to health information and services. Also, data is often fragmented and siloed in different systems in EMRs, and this makes it difficult to share among clinicians, so they have a really good comprehensive view of the patient history. So much of the data is unstructured notes, making it difficult to mine. Then consent. So every application, every data source manages consent using different methods and records the information in different places. So we've got to have a system, a process, a set of policies that allow consumers, patients to provide permission and consent for how they want their personal information and health information to be collected, used, shared, and disclosed. So how does access fit into this topic? So looking at the access gateway, I believe Infoway can help break down some of these barriers. Later today, you're going to have a chance to hear from Mario Voltolina, who is our CTO. Mario is going to do a demo of a prototype of the identity consent management of the service feature of the gateway. The goal is that the gateway will provide access to more data across the country, either directly or through local gateway-like platforms, provincial or regional, and it will produce a single set of APIs that will allow for a single connection from coast to coast, and there will be one set of rules for everyone and a single point for consent management to enable citizens to make informed decisions about data access. This is all going to be built around a trust framework, and more will be spoken about that by Joni Brennan and Sarah Wickman this afternoon. But it's really a way to get an enabler tool that is going to be common across the country and will link into the provincial systems. So the future of technology, we believe the Access Gateway specifically and the Access program generally position us well for the future. There are a number of emerging technology trends that likely have a significant impact on how we will deliver care in the future. And those we heard yesterday from Alexander about artificial intelligence, how this is receiving an awful lot of attention. Dr. Eric Topol, in his book, Deep Medicine, says that AI has the potential to transform everything doctors do, from note-taking and medical scans right through to diagnosis and treatment, greatly cutting down the cost of medicine, reducing human mortality. And he goes on to say that by freeing physicians from the tasks that interfere with human connection, AI will create the space for real healing that takes place between a doctor who can listen and a patient who needs to be heard. Closer to home and closer to present time, Kids Help Phone is using an AI algorithm within their crisis text line to analyze the tone and language of text received on this service. And they use that to prioritize kids who are at most risk of committing suicide, so they can respond to them immediately and not have them hanging on in the queue. So artificial intelligence, of course, also requires tremendous amount of data, which must be gathered, stored securely, normalized, annotated, and so on. And again, I think the access infrastructure can help, smooth this process as well and help with some economies of scale. Another area that's talked about a lot is genomics. Genome-based research is already enabling medical researchers to develop improved diagnostics, more effective therapeutic strategies, evidence-based approaches for demonstrating clinical efficacy, and better decision-making tools for patients and providers. Imagine the difference that treatment will make tailored to a particular patient's genomic makeup and improving outcomes. I mean, that's going to be an incredible contribution that can be made. And again, this technology requires access to data, privacy, security, consent management as well. So you get the idea. We can also build on this robotics, bridging the gap between humans and machines, performing tasks with excellent precision, wearables like the fitness trackers, smart watches that collect personal health data, help alert you when your vitals are out of sync, sensors and the Internet of Things that have been showing real promise in elder care, for example, and areas like that. All of these technologies have tremendous promise, and now here in pockets across the country. They've got tremendous potential, and we believe that Access Gateway and the economy of scales that it delivers and the framework around it that allows us to trust the data and those that access it will help facilitate and accelerate our transition to the health system of the future. So this comes up to what's next. And yesterday, Sheila announced that over the next 6 months, we're undertaking a set of initiatives to gauge what Canadians want from their health system and to determine how technology can help meet those needs today and also into the future. So to that end, yesterday we launched a Healthy Dialogue, which is an engagement hub where Canadians can share their stories and have their say. I encourage you to go to ahealthydialogue.ca and contribute your thoughts to this program. Now, in parallel to the public consultation that we're doing, we're also going to be doing an analysis of future technology and other trends that will impact how care is delivered. And this is going to be a global analysis. It's going to be a state-of-the-art one, and we're also looking to our partners to help contribute towards this. Jane Holden will, in one of the concurrent sessions today, talk a lot more about this exciting initiative. So that brings me towards the end of my talk. We are really excited about the progress we've made in a year. And we really appreciate your input and help. And it is through partnership that this progress it has been made. And we're still in a very active journey. We look forward to accelerating the pace of progress over the coming year. We look forward to more effective and meaningful collaboration that will get us to a shared success through our Access 2022 program. We're going to continue to engage with Canadians who we ultimately serve through this alliance and also other means. We're going to be engaging with industry who are vital to building the ecosystem we need, and we are continuing to engage with frontline clinicians, clinical leaders, and also new professionals to ensure that digital health solutions are meeting their needs so they can deliver optimal care. And of course, very importantly, with our provincial and territorial partners, we will continue to support you in improving health system sustainability whilst advancing the shared priorities that we all have. So that's kind of the end of my presentation. I really want to thank you as an audience for, dedicating your time to come here. Thank the Infoway team as well for, doing a very effective management of this program. And then I think we've got some time for some questions, and so we'll move to a bit of a Q&A session in the last 15 minutes or so that we have. Thank you.
All right, so welcome back for day 2, everyone. And I'm going to be asking Michael a couple of questions. He's in the hot seat for a couple of minutes. And we'll probably have time for a couple of audience questions. So once I have my turn, there's a couple of mics in the room, so get your questions ready. So the first thing I just wanted to ask you about, and this is the issue that comes up time and again, we hear all about digital innovation and how it's going to transform everything, but the real key is getting patients to buy in and trust this system. And there's, a lot of issues around security, privacy. So how do we bridge those gaps? What are some of the challenges there?
I think it's certainly very true that, one of the top issues is that people want to know that their information is secure, and it can be used by the people that need to see it. I think we also know that, and I've got experience with some of my older relatives who have chronic diseases, they do like to share their information. They want to know about the experiences that other people have suffering the same illnesses. They want to actively look at their results. And, I think that's the kind of role that Infoway can play here, is that, we are a kind of neutral party. And one of our goals is to make sure that we do, kind of create an environment where the information can be shared in a secure way. I also do believe that, the discussion yesterday, there was a lot of discussion about, having access to private and public sector and so on. I think that, of course, people, if you have a urinary tract infection, you don't want to suddenly get sent lots of online adverts about complementary products about it. On the other hand, if you have a cancer or something like that, I think you would want your information shared so that companies and researchers can come up with better cures, and also not only to benefit yourself, but to benefit others. So I think there's definitely a role for sharing data, making that more available for an improvement of healthcare overall. But of course, the key thing is, it's got to be secure, or the patients will lose, the public would lose trust in that system.
That's right. Is keeping on the theme of sort of patients, because at the end of the day, that's sort of what we're talking about. We've heard a lot in the last number of days about getting patients engaged. And I was wondering if you could talk a little bit about how Access 2022 it can help with that sort of thing, getting patients involved in every step of the way.
Yeah, well, I think certainly if we want to involve patients, then we have to get out to consumers and make them aware. And one of the challenges that, Infoway, we haven't been a public-facing company, so we worked with an agency to help bring up this more public and kind of consumer-facing program. But in the end, I think that the role that we have is also not just going direct to consumers, but the important role of communicating with healthcare professionals, with the health ministries, and helping them really create their links with consumers. So that if you're in Ontario, for example, you may want to log into a My Health Ontario website to see your health records, and I think that's something that people really want to do. And Infoway may be behind that, helping the province do that. And also in a similar way, we would be, helping provide uniform standards and, kind of accelerating the adoption across provinces. So, I think we can certainly help with public awareness, but the key thing is to help the caregivers really give them awareness as well, private sector, all the players that are involved in this.
That's right, yeah, because we always hear, for healthcare professionals, they're already so strapped, and there's only so many resources to go around, so that would be an important role to play.
But I think we will see that, consumers will start to demand these services. I think we're seeing virtual care is beginning, where people can do a FaceTime consult. At the moment, it's being offered through company healthcare plans. But I think there's tremendous demand from the public to say, why can't I do this with my public health system?
Right.
And we know it's going to save money. And once people get access to these tools, it will proliferate.
Yeah. I often hear that, those analogies, I can do the banking on my phone, why can't I do healthcare on my phone? And, I wonder if, and then I'd like to open it up, so please get your questions up to the microphone, but, how do we make sure that those are still tied to outcomes? Because I hear often from companies who are, promoting a new innovation, a new digital product, but how do we ensure that it's always tied to sort of ensuring that there's better care at the end of the day? It's not just, something new and shiny.
Yeah, I think that's important. I mean, it can be difficult to demonstrate the benefits, and we have, a lot of people at Infoway that their goal is to look at the benefits of digital technology. Does it eliminate unwanted tests? Does it improve healthcare? What cost improvements can it produce? I think one of the issues, though, there always will be other patients to fill those spaces. So, in the end, we have a surplus of demand and a deficit of supply. So if digital technology can improve that situation, there will still be people filling the beds, the doctors will still be busy, but hopefully more important cases will be seen first, and the outcomes overall will improve.
That's a great goal. I'd like to throw it to the room. Does anyone have a question that they would like to have answered? We've got mics in the room, and
hi there. We've got a couple questions on the webcast. First one, how do we help patients maneuver through all the various apps and understanding the privacy statements and various nuances of how their data may be shared, sold, etc.?
I didn't quite. How can patients understand?
How can we help patients maneuver through all of that?
Yeah, well, I think that's a very big topic, and probably there are other people on the team later today will talk more about that. But I think one area is, if we're looking at a consent kind of framework, I think it has to be something that is very easy for people to navigate, and so that when you sign up, for a personal health record or something, that you would have, a kind of the ability to kind of, check box of who you want to share the information with. That's the kind of practical side. But then, I think again, through programs like the Access 2022 program, there's an opportunity for us to kind of bring some of these topics into the public domain, to have more discussion and debate around these areas. Because, certainly, there are a lot of questions that people have. And I think it's all our role to kind of help educate the public on what is possible with this technology.
That's great.
Thank you. Got another one, a couple more. How will clinicians participate and benefit from the Access movement?
Clinicians can go to access2022.ca, sign up there, and then there are specific programs that are aimed, kind of role specific, so there are programs there for the clinicians. Also, generally, I think in programs like this, through the partnership program, other initiatives that we're doing, we have an awful lot of initiatives out there across the country with various opportunities to participate. But you're also very welcome to email me, and I'll try and help you through that process.
All right. Are we looking at international leaders for lessons on access?
Yeah, certainly. Part of this healthy dialogue, as I mentioned earlier in my talk, is going to be a kind of environmental scan where we're going to look at best practice. We invited Simon Eccles here from the NHS so that we could also share some experience there. And through this global digital health partnership group that we're involved with, that basically brings the digital health agencies from 20 plus countries together, where we're looking at top issues on digital health. And there's a lot to learn, and we can teach some things to countries, but we can gain a lot of really good examples of best practice through those programs.
Okay, we'll give the floor a chance.
One thing I just wanted to pick up on quickly, we had heard from Simon yesterday, who was talking about how they've managed to really innovate and move forward with their integration of digital health. Just wondering if you can reflect a little bit just on that and some of the lessons that, when you heard him speaking yesterday, how some of those things might be brought to Canada, hopefully someday.
Yeah, I think that one of the topics that was kind of mentioned is that it's not so much the technology always, it's also the kind of change management process. And we all know that, we have a great health system, but it's a siloed system. So, we are a collection of 13 different health systems. One of the benefits the NHS has is that they are controlling the health of a large population, the clinicians and all the staff, salaried staff working for the NHS. I think that that's a very different kind of situation in Canada. And the provinces, though, are all kind of trying to tackle this issue. And we have seen, different approaches where we've got organizations like Alberta Health Services and so on that have been brought up as a government department responsible for delivering healthcare. And I think those kind of models are being looked at in various different jurisdictions. But it's not an easy task because, when you have physicians who are paid on a fee per kind of service basis, and then you're bringing digital technologies, you also need to have the fee structures that help there. And, we have seen that there have been some great examples. In BC, we're kind of, really started off with some of these digital codes. Mm-hmm. And I think, again, that, I know that most provinces are looking at how they can change the way that they reimburse clinicians to kind of bring them up to the digital age. So there's a lot of different issues that we need to look at. But I think the encouraging thing for me is that digital is really, high on the health agenda of every province at the moment. And so I think that through collaboration, we can achieve an awful lot. But it's not an easy journey because of the way our system is structured.
That's for sure. So we have one question right here.
Am I on? There we go. Hi, everyone. Holly would have been from Université Laval in Quebec City. So I'm taking pity on you. You have no one asking questions from the floor. So I have a question about the ethics of the private partnership, private-public partnerships. And I think there's a question there as well about to what extent are people enabled, are people supported in being able to share their data with companies whose business practices they feel are good, and to withhold their data from companies whose business practices they may not approve of?
Yeah, that's an interesting one. So, I think through a consent management system, that should be, that kind of feature should certainly be there. And, I think from our point of view, our key responsibility is to make sure that patient data is secure and it's treated in an ethical way. On the other hand, of course, we partner with the private sector, and the private sector has a big role to play. A lot of private sector systems process patient information, but they have to keep an ethical wall there. And so just talking about our access program, for example, one of the plans that we have is to promote the Access Alliance to really bring in companies that have got solutions, digital solutions. They may be small entrepreneurs up to large companies that are providing digital services. And we want to have them join our alliance. We want to have their services on our platform. But we will have a base of rules that will make sure that any company that's connected to that program does have an ethical wall, that does have access that they need to have for the information, and not only that, and that we fully respect patient care. It's a topic that is very front and center for us. It has been on our Prescribe It program, and the program is totally dependent on having fully secure patient data. And we have a team of people at Infoway who are kind of dedicated to help that. But I agree with you and the kind of sentiments behind your question that data security is primary, and if any company misuses it, they won't be connected to the system.
So just to be really clear, I'm not asking about security so much as there are companies who will use data to advance health, and then there are companies that will use data to increase their profits at the expense of health. And there's nothing wrong with seeking profit, but people may have feelings about providing their data to some companies versus others. So I just hope you'll consider that as part of the ethical framework, because it's not just about security, it's also about providing something that is valuable to these companies, and what are these companies delivering in terms of value to the Canadian healthcare system in return.
Yeah, no, I think that's a great statement, and it's a very important kind of framework to respect, definitely.
Thank you for that. So we have just about a minute. We have one quick question from the webcast, and then we will let you off the hook.
Thank you. Can't get to all of our questions, but one last one. Can Infoway help to ensure that virtual care upholds the values of the Canada Health Act?
Wow, that's a very great question.
30
Absolutely,
seconds.
we can, yeah. But yeah, I think, certainly, our Infoway is, driven by purpose, not profit. And so, basically our goal is to help improve the health of Canadians, and that's it. And so I think that really does, measure up very well against the Canada Health Act, and, I hope we would respect that very much. Thank you.
Well, thank you so much for these wise words this morning and for answering our questions. And that was fantastic, and for a fantastic conference as well. So I will let you off the stage, and now I get to give everyone my take on the next 4 years of government.
Great, thanks very much.
Thank you.